Thank you for volunteering as a medical student mentor for the Health Career Academy. My name is Liana Gefter, and I'm a physician and former inner city school teacher and the program manager of the Health Career Academy. By the end of this 6-minute overview, I hope you'll feel ready to implement the 10th grade program at your partner high school. The layout of the 10th grade program includes a big kickoff event, sessions with you, the medical students at the high school, sessions with health providers, possible field trips, and then a big finale, medicine and the arts event, where the high school students present a health topic. At the kickoff event, all of the high school students come together in a large auditorium and are told that they're going to be medical students for the day. They receive a brief lecture about how to read x-rays and EKGs and about ectopic pregnancy and aortic aneurysms. These topics were selected because they are each highlighted in cases in the pilot episode of the show ER, which students watch after the lecture. High school students get excited that they understand the health topics they see in the show. Lastly, we hope you can join the high school students for lunch to get to know them personally prior to going out to their schools. When you go to their school, initially you'll bring ER case cards as pictured here. These cases can be found and printed double-sided from the Health Career Academy website. You will need to enter the password CASES in order to get them. To make it engaging, we like to tell the high school students, don't look, just pick a case, just like in the real ER. You never know what will walk in the door. The students should be broken into groups depending on how many medical students attend the session. For example, if there are 4 med student mentors, there will be 4 groups of high school students, and each group will pick a different case to research. At the end of the class session, each group will present the case. There are 16 cases. Each case comes with the same cover. Here are a few examples of the cases. Each case comes with a brief description of the patient and his or her problem. Then there are a few suggested research goals for that case. Case 1 here is a motorcycle accident and an open fracture. Case 2 is a subdural hematoma resulting from an older woman slipping on stairs. Case 3 is a man with a recurrence of a kidney stone. Although no props are necessary, if you want to bring in a model or pictures of some kind, that's always helpful. We don't expect that you're an expert on these medical issues, and part of your research with the high school students should include you letting them know how you would approach this case as a medical student if it were your assignment to do a case presentation. You also shouldn't feel limited to the research goals written on the case. There are lots of options for case discussions. Most important is to gauge student interest in the topic. For example, do they have relatives who've had this problem? Is it a problem in their community? You could discuss risk factors for the problem. Was the problem preventable? You can talk about what kind of physical exam is needed for the patient. High school students love to learn physical exam skills from you. For example, if you're talking about a pneumothorax, it would be great to allow students to use your stethoscope to listen to each other's lungs. You could discuss differential diagnosis for the case, emphasizing how doctors always use critical thinking skills to think about all the possible causes of the problem. It's always helpful to explain medical tests that are needed so the high school students get an understanding of why you may need blood tests or scans. When discussing treatment options, it's great to share how one goes about determining the best treatment. How do doctors decide? Because this is a health career academy, we do encourage you to talk about the different health professionals who are needed to collaborate to care for a patient in the emergency room. This will also be helpful if you create an ER skit for the finale presentation. Lastly, it's good to talk about what follow-up might be needed after the patient leaves the hospital. What should be communicated to the patient? What medicines do they need to take? What's cause for concern that should bring them back to see a doctor? What might the role of family members be? After your first few sessions with the high school students, you'll begin to prepare for the finale presentation, in which the high school students select the health topic that's important to them, which they will present in front of the other students at the end of the program. Students might want to create a list of topics and vote to determine the health topic for the finale. The finale presentation should be approximately 15 minutes in length and should include one artistic representation of the health topic, such as a skit, poem, rap, or other creative endeavor. It should also include a short explanatory didactic PowerPoint about the topic. The goal is that every high school student has some role in the finale presentation. It's your job to coach the students to create a professional presentation that they can feel proud of. One form of presentation that's often successful is creating a skit. Here's an example of an outline for developing a skit that might be helpful. You might consider 4 scenes: one outside the ER where the problem occurs, the second an ER triage, the third a discussion among healthcare workers, and the fourth a treatment and follow-up plan. This is just an example. The most important thing is that you emphasize the skills of communication, collaboration, and critical thinking. Here are some tips for success at your partner high school. Try to arrive early. Make sure you introduce yourself to the teacher and to the students. Tell them about yourself, and if possible, try to share a personal story. High school students always remember that. Remember that the teacher is an essential partner in this process, so make sure you establish a relationship with the teacher and a means for communication. Most importantly, try to establish a personal relationship with the high school students. Learn their names and use them, and take time to talk to them individually. Research has shown that one of the most influential factors determining whether a student graduates from high school is whether there's an adult in their life who encourages them to do so. Hopefully that can be you. It's important to keep in mind that partnerships with underserved schools always have challenges. It's the rule and not the exception that there's going to be frequent last-minute schedule changes, students called out of class, active classroom cultures, difficulties in communication, overwhelmed and overburdened teachers, students with multiple life stressors and low literacy levels. And it's often easier if you anticipate that these challenges will occur and know that despite the challenges, there are very clear benefits to this work, benefits that include changing the trajectory of the high school students' lives. I hope you can find this experience rewarding. Please reach out to me with any questions or concerns. Thank you.